Good afternoon. It's 4:00. We have a quorum. This is the Thursday, February 21st, 2019 Board of Health meeting. Before we get started, I'd like to remind everybody this meeting is being recorded by video and audio. And anybody out in the public have anything they'd want to talk about before that's not on the agenda? Seeing nothing, we'll move forward. We're going to do the director's report first.
Yes, I'm just going to pull up my tick-borne disease numbers. Just a moment, sorry. Okay, so we've collated the 2018 tick-borne disease information. As always with the HIPAA compliance, if you look at them, if it says less than 5, it means that there was at least one, but no more than 5 here. It's mainly to protect the identity of the people who have had those illnesses. But in good news, Lyme disease numbers were down, both probable and confirmed, and even suspect. We mark all 3 of those as in our report, mainly because some of the doctors on the island, when they see the rash or when they suspect Lyme, they will start the antibiotic treatment before the blood draw happens. So as a result, a lot of times the lab report comes back negative, even though they were still logged in as a Lyme case.
So it's confirmed, suspect,
and probable.
Is this trend statewide?
This is, statewide from what I saw. The further out west you got, the closer to Lenox, Mass. and Pittsfield, they actually had an uptick, pun intended, in tick-borne disease numbers, mainly because they had a much wetter season this last year. So, honestly, kind of a mild summer. It wasn't too much of a dry summer. So their numbers went up a little bit. But in Eastern Mass, we did see a dip in Martha's Vineyard as well.
And I'm sorry.
The reporting regulations changed at all, or are they the same?
The regulation has been the same. The only difference is from now on, you'll see a column that says tick-borne other. That is now taken down. There's no category for that anymore in the reporting system.
So why are they not down? Well, you're our health director. Why are they down?
I would love to take credit saying that it was our education.
I think that's what it was.
So it was all the information that we've been pushing out in all the different languages. This last year, we had the capability of pushing the information in Portuguese as well. And Florencia, our public information officer, she was able to get the information into the Spanish Mass and the Portuguese Mass at the churches. So that definitely could have helped. There is also the normal causal factor. We had a different season this year than we did last year, just in the terms of weather.
It was dry.
So it was definitely dry. They need the wet.
They like moisture.
Yeah, they need the wet season, which we did not have. So we're seeing actually a similar trend. If you look down at our trend numbers, you'll see that we had a dip in 2015 in comparison to 2014, where we went from 175 cases down to 104. If you remember 2015, that was my first year here. It didn't rain for about 70 days straight. It didn't rain from July through to September. And then the season really crashed.
Are we sure? Well, we're not getting all the cases, I'm sure, but you think physicians are reporting better, or is this because they're just not reporting?
The cases will always be underreported. That's just, unfortunately, the nature of a surveillance system. In this case, I don't think so. We had an intern actually go out and check last year. We weren't able to do it this past summer. And even then, their reporting cases was only 64 cases of Lyme. So they are still reporting. We're going to see this coming year, actually starting yesterday with the new hospital, all the doctors practicing under the Nantucket Cottage group are now practicing in one
Right.
co-located area. So we're hoping that if they're underreporting, it'll report better.
So here's another thought. Supposing this trend continues for the next 5 years, will we be justified by introducing genetic mice? After a lot of work and a lot of money has been going into that project.
Well, we're actually, if you were to go by the numbers, and if you were to go by the regression in the report I gave you,
I saw that, yes.
We're expecting actually a high number next year.
Okay.
In 2005, we had 53 cases. In 2006, we had 60. So very similar to the last 2 years for us. But in 2007, just a year later, we had 160.
Mhm.
So 100 case jump in one summer. So we're probably just in the cycle right now.
Yeah, I'm sure we are.
But if the trend does continue downward over the next 5 years, there is possibility that we can lose traction with town meeting and the mice program.
I mean, if it goes down in 5 years, I would have a hard time. I am a great proponent of that project and support it, but we'll see.
It would be really difficult to justify that project, actually, if the trend continues down.
Yep.
So it's
Well, I'm going to, as I said, there's a professor in Iowa that wants these. I'm going to send them to her, and I'll send it to our colleagues at MIT.
it'd be perfect. It'd be great. And so, if are there any questions on the tick-borne disease information?
Do
I
we
sent?
know anything of Martha's Vineyard?
From what I've heard anecdotally, when I spoke to the health director in Tisbury at one of our health agent coalitions, they had also numbers down, but I don't have any hard numbers. I can ask them for it. But yeah, they did see a dip as well, and compared to last year, because the Cape and the islands saw the same season
thing.
this year. You start seeing they did have about an average season in Metro West communities. When I spoke to Sam Wong in Framingham, same, more or less the same season.
Right. And the anticipated weather for the year, who knows?
The weather this year has been all over the place. We were anticipating a brutal winter season this year, and we didn't.
No,
It was pretty mild.
It's been wet.
So it's been wet.
it's been wet.
So this summer might be.
If it's still wet, then those numbers, well, we'll see.
Yeah.
Go the other way.
Yeah. And then, so we're hoping that we can continue the trend, but we will have to push out more information with the public information officer. And it's always a cycle. We have to continue getting the information to the churches, to the landscape community, to all of our language communities that we have.
I'm doing a talk in May at the Nantucket Hotel on the subject.
Perfect. So if you give me information on that, we can push that out. And then one more thing, we received the green light 2 weeks ago from the select board to move to the fire station to the once they've moved here. So okay, I was going to say we will be moving to the fire station once the old fire station was vacated. They're expecting the old fire station to vacate in April 15th. And then there will need to be some renovations. Floor needs to be redone, some painting.
What is the long-term plans for the fire station? I've been reading about, would you move in and then move out, or?
The theory is that we will move into the fire station for a maximum of 5 years while a permanent town facility is built to house all the departments. The original report was the original intent about 3 or 4 years ago was to build a town building at 2 Fairgrounds Road, where the Plus department is now, and built it phased like the hospital so that we do not disrupt service in that time frame. So the theory behind it is we will be in the fire station until we can move into a larger building, a permanent home. But in the meantime, we will be co-locating Human Services and the Health Department and Natural Resources Department in the fire station.
And that's why as soon as it becomes ready.
As soon as it becomes ready, there's some work that needs to be done to the building just to get it ADA accessible and code compliant. But after that, we can move in.
Is that good?
I think we're good.
Good. The minutes to get a chance to look at it was a short meeting.
I wasn't present, so
Yeah.
I will abstain from voting on those.
Move to approve the minutes of January 17th, 2019.
Well, it's
So-
interesting procedural. We have to have three.
We have to have three. Yeah.
I just feel uncomfortable voting on something that
No, I
I,
know.
so maybe we just put them off.
Just
can put 'em
do
off.
it by consent.
Okay.
Whatever you.
The chair is allowed to second.
Okay. Well, I'll
Procedurally.
second it.
Yeah.
All in favor?
Hi.
Aye. It was very short.
Right.
I looked it over. It was all
Yeah.
good. Okay. Discussion on reduction strategy for food services.
Okay, so we were approached by the Fairwinds community with an idea for not service for Narcan naloxone training as a harm reduction strategy, and I'll let Hugh explain. If you can use the microphone right there.
Yeah.
Thanks, Roberto. Can you hear me? Does this work? So
Could you just
Oh.
identify yourself for the?
my name is Hugh Robbins. I am the outreach and prevention coordinator at Fairwinds. So Roberto and I have been discussing this issue about having harm reduction Narcan trainings implemented in to perhaps the choke saver trainings, as an attachment, with the hope of it covering, a yearly requirement a yearly permitting requirement for every bar and restaurant that seats with up to 25 or minimum 25 seats. And for me personally, I think that having Narcan and I provided you with some information on it as well. But having Narcan as an available resource for restaurants and other places where large groups of people gather, I think is something that's beneficial to the community and needed. Nowadays, it's almost as if it's as prevalent as needing CPR or needing an AED. Not only is the Narcan drug itself very effective, but also the educational part that comes with the training is extremely informative. And I think it would be very effective, and I think it would be a good idea to consider it as part of a yearly requirement for restaurants.
So the choke save training is already something that people do. If you have 25 seats or more in your restaurant, you have to have the choke save training as part of the state law. When we spoke to Julian Sear, one of the suggestions he made was that we would implement something like this through the Board of Health as part of a regulation. If we do something like this, it would have to be a new regulation. We would have to hold a public hearing. It would have to be vetted by town council first. And even then, it would have to be phased in because not every restaurant has their choke save expire at the same time. So in that, it would have to be a long-term effort. The only pushback that I have heard on this was actually from our fire chief. He actually told me yesterday at the Board of Selectmen meeting He has a little bit of a fear that with something like this, we would have to put in the regulation that if naloxone or Narcan is administered, that 911 is also called.
Absolutely.
Yeah, absolutely.
Because there have been instances that they have seen where the naloxone has been administered and then 911 was never called, EMS was never on the scene, and because of the nature of how naloxone works, the person automatically comes down from the really kind of crashes from the high, and then ends up automatically in withdrawal, so they can end up overdosing again within a couple hours. So that's the only fear. That's the only pushback that the fire department I've heard so far. But we would have to. I can work with Hugh, but we would have to write up a new regulation to do this. But before we decide to, I would need.
Yeah, the other problem besides going to withdraw again is if they really didn't need the Narcan, well, that would be safe. The problem is then whatever is causing the problem doesn't get diagnosed.
There's no risk to administering Narcan. Correct you?
Right.
Oh, I agree. But if someone does it because someone is unconscious or whatever, and that's why 911 has to be called.
Right. Prior to
I
administering.
can administer Narcan to you right now and it wouldn't hurt you.
Yes.
Right. But if
Yeah, but you need to, I get it.
you know what I'm trying to say.
Yeah.
Right.
The good news about something like naloxone is because it's an antagonist, it only reacts with the agonist inside the body and not the receptor. It's a competitive inhibitor, which is a good thing. However, we also need to have EMS response.
Right.
That is, and that would be
And that's in the
something that we
training
would
as
have to-
well. Yeah.
Yeah.
If all the restaurants receive training from,
Yeah.
say, me or Fairwinds, that's part of the training. Like it's
Exactly.
always first call 911, you know.
Then,
Yeah.
yes. So,
I'm looking at the list of where you've implemented successfully at the yacht clubs and Nantucket Hotel. Community sailing just makes me think, because I work with Mariah Mitchell, camps. Not necessarily the children who are attending camps, but if you have interns that are high school and college age.
the camps are actually regulated by the state.
Okay,
That's the part that is a little difficult for us.
okay.
We can set local regulations on restaurants, and we can put restrictions, but camps are actually one of those things
you
that
inspect camps.
we inspect them on behalf of the state. We only enforce the Mass General Law.
I got you. It's
So
not
it's
Did
a
we
little bit
discuss-
more difficult.
local regulations on.
The pools, the lifeguards,
Okay.
the swimming portion, and that is locally regulated. However, I could speak to the State Department of Health and see if we can do a stricter regulation for something like this. It might actually be easier to get something to the camps first before we can get something to the restaurants.
I mean, the way that I see it is I would like to see some forward progress with the restaurants. Because
Yes.
I know that's, like opioids can be in.
Yeah.
The TV has
Sorry. So for example, in the summer months, you might not think of many people taking heroin or overdosing from heroin, but it can be in a prescription, the prescriptions that elders take.
Mhm.
It can, anyone can, overdose from prescription drugs or, from opioids. It can be in cocaine, from fentanyl.
happened
So,
already.
and the way that I see it is, a large portion of the summer residents, they enjoy the parties. So, let's just work proactively to be in front of an issue instead of pushing something off and dealing with it down the road when something bad actually happens. So that's my biggest.
Well, Mr. Chairman, I would support moving forward.
So, right.
Perfect. So we'll connect and we'll start working on a harm reduction strategy for the restaurants.
Excellent. Thank you.
Absolutely.
Thank you.
Okay.
Loan request.
Yes.
38 won't win it.
So we have a loan. We have 2 loan requests on the agenda. We can vote on them, but we cannot sign the paperwork yet because the extra $2 million has not been released by the SRF yet from the state. So once that money becomes available, then we can have this signature. That's just a heads up. For this 38 wall win it, it's a septic repair. It's fully compliant. They don't need variances.
Right.
So we support it.
Can I get a motion to
I move that we approve that loan.
Second.
all in favor?
Aye.
Release of an ACO 255 Nantucket.
Yes. So 255 Nantucket had an ACO on it. They were paying into it. They've recently decided to actually do a full compliant repair on the property. So we need to remove the ACO from the property so that they can move forward.
Can I get a motion to remove the
I move that we remove.
second?
Second.
All in favor?
Aye.
Aye.
And then same property. Now they're looking to do a fully compliant repair loan.
Can I get a motion to approve the loan?
So moved.
Second.
All in favor?
Aye.
Aye.
Okay.
Okay. Fertilizer regulation discussion.
Yes. So there was recently some information that we have been a little lax on the fertilizer regulation. The regulation does not have a lot of teeth. There's a big issue regarding getting onto properties to do inspections. We cannot cross what's called a curtailment without a warrant. So if a house is behind a fence, that's it. We don't know what's being applied. So basically, if it's waterfront property, any house on Shakamo, Pocomo, most of Low Beach, Sconset, we have no idea what's being applied. So in consulting with Jeff Carlson, we've come up with some changes to the regulations. Were sent to you and they're in the packet with comments and information. What we're looking for is to also get a consensus from the board so that we can move forward with this, so that we can send this to town council for review. And then we should schedule a public hearing so that we can get it on the books for this application season. And I think actually the land council is here. I don't know if they would like to speak or.
Did you get a chance to read that? Yeah. Thanks.
Yeah, we just need the public record of it.
Yeah.
So.
Cormac Collier, Nantucket Land Council. I did read it. Great step. Just want to extend my thank you to Roberto for doing this, and it certainly beefs up the regulation.
And Jeff.
And Jeff, and really puts in that reporting requirement and some other additional things. And Em and I are going to read through it a little bit more, and maybe there'll be some additional ideas going forward.
Yeah, the big difference in this regulation that wasn't there before is a reporting requirement. So there's a state requirement already for how much fertilizer is being placed. Right now, though, we're not state agents, so we cannot ask the landscapers for that information. What we've put in this regulation would allow us to do inspections at a reasonable time, go in and look at what it is that's being placed. And we can look at fertilizing programs so we can see if it's following the best management practice or not. And if it's not, what we've come down to is the regulations are much more strict this time. So we have added in the enforcement side potentials for suspensions, which was not in the regulation before.
I think it's a start in the right direction. I think there's a weakness in the system, and that has to do with the individual landowners. Because they're responsible, and I've been thinking about how to get to them, and if it's all right with the chairman and the health director, I'm going to explore some educational ideas. I could see like a minute or two spot in the Dreamland,
Yes.
reminding people that it's their responsibility, regardless of who they hire. I mean, who are they hiring? Are they following the rules?
One of the things that we've put in this regulation as well, one of the changes is whenever we do witness a violation, we need to notify the homeowner as well. Before, the landscaper just got a warning or a ticket and they never had to tell the homeowner. Now it's we notify homeowner.
I was at an event actually 2 summers ago, very close to the water, and I'll tell you, it was a beautiful lawn, all about 200 feet from the harbor. Okay. And I talked to the owner, and he just was kind of didn't understand it, Yeah. So, I mean, I think he's now going to be a little more careful about talking to his people, but we need to get to those people.
One of the things we've been hearing about, and only some of the landscapers has confirmed that they do this, and I'm not going to say their names because it can affect their business. When there's an event like this, one of the big events, and the lawn isn't up to the owner's code, they actually paint it.
This wasn't paint, but I've heard the same thing. Well, and what's the paint?
Yeah, and that's the
what's
thing.
the paint?
The paint is actually very phosphorus laden, which is part of the thing that
so
we don't allow to be placed anyway.
Maybe you should include something about paint. You can't paint your lawn. I'm serious.
It sounds ridiculous, but it's true. It happens.
There should be a part of the regulations that say you just can't paint your lawn.
Absolutely. Actually, I'll put that in.
It's happening. Might as well do it.
Yeah.
All is vanity.
Yeah.
Well, I have no grass on my property, so I.
All right.
Would you want to set this? I mean, you definitely want to. Things start April.
It's starting soon.
14th. Our meeting isn't until the 18th, I think, in April.
The reason I don't want to put it in the March one is because I don't know how long town council will take in reviewing it.
Yeah.
If we set the hearing and then town council hasn't reviewed it, we either have to push the hearing back and re-advertise, or open the hearing, set a new date, and then continue it.
Don't we have to have 2 months notice or something?
It's 3 weeks.
3 weeks.
We have to put the advertisement in the newspaper for 3 weeks.
Do you want to set that date now, or do you want to wait for this next thing to with the rest of them?
We can set it all to all three of them together,
Yeah.
or the dates for all three of them in the next agenda item.
Okay. Anybody have anything else on? No? Okay, well, we'll go to that. We'll go set the dates for these upcoming discussions and hearings.
Okay. So with the Nantucket regulation, that's relatively simple. We're pushing back the implementation date by 1 year so that we can get the information from the landfill study.
I'm sorry. This landfill study we've been talking about for a year and a half. It was always going to just be around the corner. And I'm just
we do have some. I think you have some at least some good news.
We have some good news on that.
I mean, are we going to have a date for that, and then are we going to keep pushing this back? Or
no, actually,
I'm just frustrated.
What we're looking for is to set that implementation date as a hard date, regardless. So the good news, like everything in government, things got bogged down. So when we spoke to SMAST about a month and a half ago and asked, where's our report? They had mentioned at that point, they had never mentioned it before, that there was an issue with the contract. So they had never started the report. So once that issue was fixed, they finally ran the model. So Brian Howes is expected to get us the report by the end of this month, which is next week. So, well, at this point, because they're the owner of the model, we can't go with other vendors, unless they create a new model, unless we're willing to pay them to create a new model. So it's really kind of what they hold a monopoly on that, on the TMDL model.
When we see will that report include details of the model? I mean, what are the assumptions of the model?
Some, not all, because it's a proprietary model.
I mean, I love models, but I'm also concerned about models if they're not the right sensitivity analysis aren't done and what the assumptions are, all that kind of stuff. If one of those things is wrong, the whole model is invalid.
Some of that will be given to us because we're using local data this time, and that's the importance of it. However, the proprietary portions of the model we won't be able to see.
Okay.
Because it's proprietary, and that's where they hold us.
I mean, I don't think. I mean,
they hold us hostage.
Are you sure he's going to have it by the end of this month? And that's after. I mean, it has to be peer reviewed again and all that. I think. If you're asking my honest opinion, I've lost faith in their timelines. When they say next week, they really mean next month. I'm glad we got an acknowledgement that he's working on it. Anyway.
Yeah. So it's really ridiculous that because they're holding this model hostage, they hold other towns hostage in the same way. Luckily, once we run this model, it should be the final time that we do.
Yeah.
But honestly, I feel that those who voted against the sewer the first time have already set their minds against it. And we need to set this hard date on this regulation because they're going to keep using scare tactics.
Well, those who are against
it back.
the sewers will always be against the sewers, regardless of what the data shows.
Yeah, exactly.
We just have to.
So at this point, it's a matter of just moving forward.
Yeah. I mean, I don't know if it has to be a year.
It doesn't have to be a year.
Yeah.
We can set it for January 1st, giving them 6 months.
Yeah, I think 6 months makes more sense. A year is.
Yeah.
We use the year because it's the fiscal year. July 1st is our fiscal year, but it can be calendar year. There's no.
Yeah, well, we'll see what it shows.
Yeah.
So we should have the report back by the time of the hearing. So if we have that report in hand, we can make a more informed decision, which is another reason why.
If we have the report, I don't want it the day before.
Absolutely not.
And this kind of thing, we have to
We have to be able to digest it.
You have to study it.
Correct. And we can always continue the hearing.
All right.
And we can always continue the hearing to another date. So would the April 18th meeting be okay for that one?
Yeah.
Okay.
Yeah.
So I need a vote for that.
I move that we have the hearing on Nantucket on April 18th.
Second. All in favor? Aye.
The second one is the fee schedule. There are some fees that are out of step with the rest of the state. If you remember, we upped parts of the fees. We changed the fee schedule in 2015 for effect in 2016. This would be a fee schedule change for the effect for July 1st of 2019. So about every 2 to 3 years, we kind of want to look at the fee schedule and make sure that we're still up to date. So I'll do an analysis on that and get that over to you. So we would need a date on that.
Figured out. Yeah.
March. Or?
The March meeting is. Let me just check when the March.
What's the date of the March meeting?
Exactly, to see if we have time to.
20 something. I think.
All right, the March meeting is the 21st.
Okay.
So we would have to get the legal notice out tomorrow to make it on time. So we can do the March meeting. It shouldn't be an issue. The fee schedule is pretty simple.
Okay. We'll get a motion to have that meeting on March 21st.
I move that the new fee schedule public hearing is on March 21st. Second.
21st.
All in favor?
Aye.
Aye.
Okay. And then the last one is the fertilizer regulation. Would we be okay with April 18th on that one as well?
Yes.
Um,
Yeah.
Okay. So
I move that we have a public hearing on the updated fertilizer regulations on April 18th.
Second.
All in favor? Aye.
all right. That is it. I think that's it.
Does anybody have anything else? Get a motion to close this meeting.
I move we close the meeting.
All in favor? Aye.
Thank you, Terry, for taking notes.